All right, let's get into it. Today we're talking about something a lot of people deal with, but, don't really talk about perianal symptoms. It's so easy to just write off any discomfort down there as one thing. But as we're about to find out, there's usually a lot more going on. Okay, so let's just ask the big question right up front. You feel something, maybe some itching, a little bit of pain, and what's the first thing that pops into your head? Oh, gotta be hemorrhoids, right? It's what everyone thinks, but is it always the right call? And that's really the heart of the problem here. There's this massive tendency to just slap the hemorrhoids label on any and every symptom in that area. And look, it's an easy assumption to make, but it might be covering up what's really happening. And this is where things can get pretty serious. This quote right here says it all. By trying to treat what we think is just a minor thing with over-the-counter stuff, we could be putting off a real diagnosis. So often, people wait until they just can't stand it anymore, and by that point, the real problem could be way more advanced. So if we shouldn't just guess, what should we do? Well, we can actually look at how the pros handle it. They have a logical playbook for assessing these symptoms, and we're going to break that down right now. It really boils down to a pretty simple 4-step process. First, you've got to pinpoint the exact symptoms. Second, you look for other, more specific causes. Third, and this is a big one, you have to factor in your age. And fourth, you learn to recognize the signs that say, okay, it's time to call a professional. And just so we're all on the same page, when we say perianal symptoms, what does that even mean? Well, it's basically a catch-all term. It covers everything from itching and pain to seeing blood or maybe feeling a lump down there. It's a wide umbrella for a bunch of different feelings. Which leads us to a really, really important question. Why does getting this right matter so much? Because some of these symptoms, they're like red flags, warning you that something more serious could be going on. That's why a real diagnosis is just non-negotiable. And look, the range of possibilities here is, well, it's huge. On one end of the scale, the cause could be something as simple as poor hygiene. But on the other, much more serious end, the very same symptoms could be a sign of colorectal cancer. There's just no way to know for sure without a real assessment. So let's zoom in on that most serious possibility for a second. Getting a handle on your own personal risk factors is absolutely key. It helps you know when you need to be paying extra close attention and get professional advice, maybe sooner rather than later. So what are these key risk factors that doctors are looking for? Well, you can see them right here. Things like a personal history or a strong family history of cancer or polyps, having inflammatory bowel disease. But take a look at the very first one on that list. Age. And that number right there, that's the one you really, really need to remember. Being over 50 years old is considered a primary risk factor. It's a simple, clear piece of data that's just so critical when you're thinking about your own situation. Okay, so we've walked through the problem, the way the pros think about it, and the biggest risks. So what's the bottom line? What's the right move to get you from just guessing about your health to actually knowing? It really just boils down to this. On one side, if you're under 50 and you don't have any of those big risk factors we just talked about, your symptoms could very well be from something minor. But, and this is a big but, on the other side, if you're over 50, if you have that family or personal history, or if the symptoms are bad or just not going away, that's your sign. That's when it's time to see a professional. And if you take just one thing away from this whole explainer, please let it be this. The point of all this is not for you to diagnose yourself, not at all. The goal is to give you the information you need to know when to stop the guessing game and get a real professional diagnosis. So I'll just leave you with this final thought. Your health is way too important to leave it up to a guess. The knowledge is out there to help you make a smart call. So when it comes to stuff like this, why guess when you can have the peace of mind of knowing for sure?